everyone, this is Dr. Nguyen at North Texas Skin and Laser. Thank you very much for joining us on our live Q&A questions. As the questions are coming in, I guess we'll be able to see it. I'm actually looking at Patricia, our esthetician, who's actually helping me. Morning, Patricia. Say hello.
Hello.
And so are the questions going to come up? We're going to be able to see them popping up,
Once
right?
people start to log on, the questions are going to be coming up from below.
Okay.
Right now, the word's being spread on Facebook that you're going live. So
okay, great.
We're going to see what happens.
All right. Well, but you know, I guess to start out, also in case that some of you may have been logging in right now. So I'm looking on, and this is, no, this is not a first question, it's something else. Okay, so if you're logging in now and you may not have a question for us yet, we actually pull a lot of Real Self question. RealSelf.com is actually a website in which there are a lot of aesthetic work has been done, a lot of procedures, and there are a lot of questions and answer on there, you know, for physicians, and a lot of remarks for patients. So Patricia, if you have your list of Real Self question, let me know.
I do. One question that we hear all the time is, what exactly is CoolSculpting?
Okay, CoolSculpting. I guess I'm seeing like a couple of things coming on, but I don't think that we have any question yet, right?
No,
okay,
don't have a question yet.
Okay,
but it will appear down there.
Okay, so what is CoolSculpting? Is your first question. Okay, CoolSculpting is essentially cryolipolysis in which subcutaneous fat is actually drawn into an applicator, and it will stay in there for anywhere from 35 minutes to an hour. The reason I say 35 minutes to an hour is that Zeltic, the manufacturer of the CoolSculpting machine, it actually has two types of applicator these days. The first generation is 1 hour, the second generation is 35 minutes. The difference between the first and second generation is that the first generation is minus 10 degrees Celsius, and the second generation is minus 11 degrees Celsius. So they were able to shorten the time down to 35 minutes. The efficacy actually remains to be the same for both handpiece, either the first generation or the second generation handpiece. So essentially, it is subcutaneous fat drawn into one of those handpieces, stay there between 35 minutes to an hour, and then once it's removed, the fat will actually be going away, 20% of them permanently from the area of treatment.
Perfect, great. You know, something we also hear a lot, doctor, especially from my friends, is, will CoolSculpting work for me? Is it right for me?
Okay, will CoolSculpting work for you, or is it right for you? Actually, CoolSculpting has been, in the beginning, basically came up with, for people actually who just have pouches of subcutaneous fat that may not be removed with exercise and diet. So it's mainly for pockets of fats. And that's what it's mainly designed for. However, as we have been working with CoolSculpting now for the past 3 years, we've actually increased that treatment to patients who with body mass index of 30, up to 32. So definitely the best type of patients are going to be subcutaneous fat or pockets of fat that cannot be removed with exercise or diet. However, you know, if you are a little bit larger and you want to have some improvement in the contour so that you can get on with exercise and diet, because sometimes it takes a little while for exercise and diet to actually lose those inches. If you want to lose those inches a little bit faster, you can do CoolSculpting that gives you the motivation. And so really, if CoolSculpting is right for anyone, they really need to come into the office and actually physically meet with us. But CoolSculpting can be used for the majority of patients. There are a few patients with medical problems that may be contraindicated, and that's why we actually ask patients to come in so we can evaluate our patient on a one-to-one basis.
Perfect. You know, something else I hear a lot, doctor, is there's a lot of med spas out there. How do you find the right place to get your CoolSculpting done? How do you choose the right doctor?
That's a terrific question. I wish they can all come to our med spa.
Absolutely.
Okay. I really think that in order for you to choose the right person to provide CoolSculpting is during the assessment. How long does each med spa spend time assessing assessing the patient? I've had some patients who are coming to me and they were telling me that basically they get a 5-minute assessment elsewhere. For our med spa here at North Texas Skin and Laser Center, we actually visit with the patients for a whole 1 hour, where we actually look to see if there's any contraindication in your medical history that would not make you a good CoolSculpting patient. And then 2, we're going to assess the area that you want to have treated, and we're going to come up with the amount of hours that are needed, or actually amount of cycles that are needed for the treatment. And then we'll also discuss the side effects of CoolSculpting as well, and having plenty of time for question and answers. And so our visit lasts for about an hour. So first of all, I would say the time spent with the patient, is it 5 minutes or an hour? Do you have time enough to discuss with your practitioner about the procedure being done? Number 2, I think that you should ask how long has the practitioner or the med spa has been out that they have been doing CoolSculpting. Number 3 is that you should actually see their true before and after pictures, and then you can go from there. And I think the most important thing is that you feel confident, you feel comfortable in that practice.
Perfect. Yes, and of course we would love it if they came here with us, wouldn't we? Okay.
And coast to coast, if they could only drive here, we actually pay them for gas. So when you think,
I know, but what's interesting is we have so many clients from out of state. We have clients come in from Oklahoma just to see us.
Yes,
from far away.
We do have people from Houston, and we actually also have people from Kansas as well. So therefore, I think the trustworthiness, the belief in what we do is very important.
Absolutely. Okay, now here's another one we hear all the time. Does CoolSculpting hurt? What is it like?
Okay, CoolSculpting, I think we actually have one question is coming up, so I will get to that question from Christina in just a minute. First, the question from Patricia, does CoolSculpting hurt? Actually, CoolSculpting is a very easy procedure to get through. It's non-invasive, and during the first 10 minutes, the areas of treatment is going to be drawn into the applicator, and you're going to feel like a pinch and pull, and that's probably the most uncomfortable time that you're going to have in CoolSculpting, for about 10 minutes, and then that area actually goes numb, and then you'll be very comfortable after that. Most of our patients actually watching TV, they sleep, they actually work on the internet, some people are actually knitting, and so their patients are very, very comfortable. So that's like the first 10 minutes really of the procedure of a pinch and pull. We do have a question from Christina. Thank you very much. Is there a limit to the number of area that can be treated with CoolSculpting? That's a great question. So the question is, where can we use CoolSculpting? The CoolSculpting are currently FDA approved for the chin, under the chin, this area for double chin. It's also approved for the arms right here. It's also approved for the trunk, so you can treat the front of the abdomen, you can treat the flank. It's also approved for the back, so you can treat the backs, the bulges that are near the bra, both the upper bulges, and then a lot of times the love handle from below, but they kind of actually push posteriorly in the lower back. And then also CoolSculpting has been used for the thighs as well. So CoolSculpting can be used from the neck, the arms, the trunk, and then also for the thighs. There's not a limit to the numbers of areas that can be treated with CoolSculpting. I think the only limitation is more so if that area can be used through an applicator, and we have certain size of this of applicator. So most of the time, most areas can be treated, and there's no limitation. Thank you, Christina.
Great question. All right, and this kind of goes with Christina's question: is how much fat can I lose after a CoolSculpting procedure?
Okay, so these questions that we actually are having, just in case there's someone who's joining us more recently, is actually from Real Self. And so these are real questions that we actually just download or actually copy from Real Self so that we can answer you. So how much fat can you lose?
How much fat can I lose after CoolSculpting? Yeah.
Okay, so maybe I'll extrapolate that a little bit. You are actually going to be losing 20% of subcutaneous fat in that area. And the question is, how do we know that? Actually, with many different studies that are being done through Celtic or independent studies, they've actually done ultrasound to look at the layer of fat, and that has been reduced. They've actually also stained the fat cells for markers of cell death. And they see that going on after CoolSculpting, and so generally it's about 20% reduction in the area that the applicator goes on top of that. And so there are smaller patients that may be just needing one-time treatment, but patients who are medium sized or a little bit larger than that, we're going to need 2 and sometimes 3-time treatment in that same area. Okay, I do commonly also get questions of actually how much weight do I lose. Fat really doesn't weigh very much, so it's not a weight loss procedure. So most of the time my answer for my patients would be really 0. You're gonna actually lose more of the inches. You lose more, you're gonna feel that your clothes actually fits better.
Great. And how long will the results last?
Okay, the results last for a good amount. As far as we know, it's permanent right now. We've had documentations where it's 5 years out. CoolSculpting has been around for 7 years now. 5 years out, patients are still the same, and as long as they're keeping between 10-20 pounds, really you're more, you're born with by the time you reach adulthood, there's only a certain number of fats cells there, and if you lose it, it's going to be likely to be permanent. The only thing is that if you actually having excess calorie all the time, that's when you're actually going to form new fat cells. But other than that, it's fairly consistent of the number of fat cells that you have, and once you lose it, it's permanent.
Great. And what happens to that fat? Where is it going?
Okay, well, the fat actually get metabolized, actually get broken down into smaller particles, and it just basically get away with the white blood cells through the system, through the lymphatic system. The white blood cells just get rid of by your body. And also studies have done into where they look into the cholesterol, into the liver profile, and none of this actually appreciatively change at all. So really it's just broken to smaller particles and get disposed of. Very similarly to what I always explain to my patient, that in cancer patient, when they get chemotherapy, well, where do all those cells go? Many times they can actually be broken down in smaller particles, and they can be get rid of by the body. The difference between cancer patients and cryolipolysis is that in cancer patient going through chemotherapy, you actually have reduction of certain amount of cancer cells within a very short amount of time. So by breaking down cells within a certain amount of time, there's going to be certain things that you have to look for, or make sure that the patients remain hydrated, or certain things that we have to actually be careful with when there are a lot of cells broken down at the same time. The difference between that versus cryolipolysis is that the cells are actually broken down over time, over the next 2 months, in very, very small portions. So really, there's no side effects to our body, and our body is able to remove it very, very well without any problem.
Since we probably have some new people joining us or just logging onto the video, Doctor, why don't you tell them what we're talking about? CoolSculpting.
Of CoolSculpting again?
Well, just tell them that we're doing CoolSculpting Q A.
Okay. Actually, so essentially CoolSculpting is in 70 countries. Currently, it is the #1 body contouring in the world, and it's using cryolipolysis. The machine that we're using is actually from Zeltic in Pleasanton, California. They're actually also a knockoff that are, where else? China. And also there is another one in Italy, in Europe, but I would not use those machines. I've actually seen reports of those machines causing too much frozen spots, so it can cause skin issues, skin reactions. We have never had any problem with our machine from Celtic, Pleasanton, California, because they have a lot of sensors there that actually monitor the skin, and if they feel that there's anything off, the machine was actually self-shut down. So we have not had any frostbite, we haven't had any problem with skin issues using our machine now for 3 years, so it's very safe.
And then why don't you tell our viewers a little bit about yourself?
Okay, well, I'm Dr. Nguyen, I'm board certified internist. And pretty much we have actually moved into the aesthetic services now for quite a while, and so we have a wide variety of things that we do here besides CoolSculpting. We also do body contouring with Body FX, which is radio frequency, and that is just basically heat. It's actually very different from the cold, and we use many times simultaneously both of them to actually create better body contouring. So we've been very fortunate to actually be able to use both modality, the cryolipolysis, cold with CoolSculpting, and then with the radio frequency. And in our case, it is with the machine that is and the platform is called from InMode.
Wonderful. Okay, well, we'll get back to the CoolSculpting questions now. I have one here that says, what are the side effects of CoolSculpting?
Okay, side effects of CoolSculpting are not that many, but commonly you may see some swelling, some bruising, the swelling bruising actually goes away in about a week or so, and then you do have some redness on the day of the treatment, and that's usually on the same day it goes away. Those are the main side effects that you're going to see: some bruising, swelling, and some redness. So that's more immediate. Usually, as we've said before, what does CoolSculpting do to the body? So to recap, you would actually have the subcutaneous tissue inside the applicator, and that applicator is going to go on for, if it's a first generation applicator, it's 1 hour, second generation applicator is 35 minutes, and pretty much within that time the area is going to be cooled down, and after it's cooled down, it's going to cause a change into the subcutaneous tissue, and that whole area actually becomes inflamed. Okay, so that inflammation actually will show itself clinically, or you will feel it about 4 days after the treatment. The inflammation will actually start right away within 24 hours of the treatment, and it will actually last for 2 months. However, in about 4 days after the physical treatment, you will actually feel a little bit of tenderness in the area treated, and it feels more like an aching tooth. The pain would actually come and go, and it's kind of a pokey type of pain. During that time, you can take a Motrin or Tylenol if you like to, just to reduce a little bit of inflammation pain. But that period of pain is only about 5 days. Okay, so again, the day of CoolSculpting, starting from then, day number 4 is when you're gonna feel that inflammation coming a little bit more prominent. You can actually feel it, and you only feel it for about 5 days. Okay, and after that, it goes away. There has been some long-term, maybe a month out of pain discussed, but these are very rare, and in those cases they're more associated with nerve pain. So practices have actually given out some nerve pain treatment, and that really removed the pain. We haven't had any of those issues basically for the last 3 years. So our common side effects are again bruising, some swelling, some redness, and then the onset of the inflammation pain that's going to happen to everyone. That's because of the fat getting inflamed. You can't get away from it. So those are the main common side effects of CoolSculpting. Other side effects of CoolSculpting are actually people can actually feel the lumpiness in the areas treated. We haven't had any of those issues either, because we ask our patient to continue to massage after CoolSculpting pretty much into the 6 weeks, and they self-massage the area. We haven't had any lumpiness of the areas treated. There is one side effects of CoolSculpting that I want my patient to always be aware of. That is paradoxical hypoplasia. Now, this side effects is actually very, very rare. With several million cycles done, basically the incidence of that side effects is currently anywhere from 0.025% up to 0.25%, so it's about 1/4%. That side effects is very rare, and it has happened all over the world, but we've seen that it's more prominent in male, Hispanic male, and using a larger applicator. We really don't know why that happened. And what is paradoxical hypoplasia? Paradoxical hypoplasia is an entity in which, for unknown reason, the fat cells actually doesn't go away, it actually multiply. So no one wants that. But the incidence is very, very small. Like I said, 0.025 up to 0.25%. And basically in that, if paradoxical hypoplasia happens, the patient will actually have a fat pad over the area treated. Now that fat pad can easily be removed with liposuction, or in our case with the Body FX from InMode as an option. We have never actually had a paradoxical hypoplasia. Like I said, it's actually very, very rare, but one of the practice that I know in Missouri actually had one, and they also use InMode machine for the heat body contouring, and they've used their heat machine with the InMode to actually remove the fatty pads. That happens with paradoxical hypoplasia. So in the very worst scenario with paradoxical hypoplasia, again, very, very, very small incident, it can easily be corrected.
Great. So how safe is CoolSculpting?
Okay, CoolSculpting, like I said, is quite safe because we've gone through the side effects, so it is very, very safe. A few contraindication would be more like if you have any problem, medical problem that would not, that you won't be able to tolerate the cold. So those are the things that you would have to come to the office for so that we can actually visit with you in person. And also pregnancy is a contraindication. The contraindications are not that many. And the other one I could think of is if you have a pacemaker or something like that, it will be a relative contraindication.
Great. Okay. Now, what is the difference between CoolSculpting and liposuction?
Well, as you know, liposuction is more invasive. It's a surgical procedure, and my understanding with my patients who've gone through liposuction before, sometimes it's 4 to 6 weeks of post-pain after the treatment. I actually have a colleague who actually was telling me about her neighbor going in for liposuction, and I don't know how many areas she's had with liposuction, but the lady eventually went back and was admitted to the hospital for pain control after the liposuction. So CoolSculpting is non-invasive. There's no downtime, and there's no, you're not required to actually change in terms of your activity. So pretty much it's like a lunchtime if you want it to be a lunchtime of treatment, and then pretty much you'll get back to your daily activity without any restriction.
So there's no downtime after the procedure?
There's zero downtime after the procedure. Now, within that in about 4 days, you may have that inflammation pain sets in. So if my patients are out at the gym, I just tell them, well, just don't do as much abdominal crunches. Most of the time you feel more in the abdomen. Really, that inflammation pain for the back, for the flank, for the legs, probably don't even feel it. For the arms, probably don't even feel it.
Great. Okay, now what if a patient comes in and has CoolSculpting done, but down the road they want to get pregnant? Is there going to be any effects?
Okay, I think that's a terrific question, Patricia. Okay, so if we have younger ladies who are not yet planning for a family, and right now you want to have, a great looking body so you can be in your bikinis, no problem. You can have CoolSculpting done. Now keep in mind that down the road, should you have a couple of pregnancies, you will actually gain fat mainly in the abdomen and also the thighs. That's where actually fat gains with pregnancy. So you'll gain back some fat in those areas. But there's no problem if you want a beautiful body now to actually enjoy life, enjoy yourself in that bikini. There's no problem at all. The areas that we do a lot in younger patients are actually that pooch in the abdomen, lower abdomen. And then we also have some in the thighs. I've actually seen back wings. Patients who are very skinny, but they also have these back wings on the side of the thighs. So those are the common areas where we see in younger patients.
Wonderful. Okay, and then this is a funny one, but we've heard it before. Can I do this at home with ice or in an ice bath?
Okay, that's a great question. We've actually had patients continue the CoolSculpting at home that they tell me about. So they come in here and they actually have their CoolSculpting done. They go home, they actually put an ice pack on it to actually continue the CoolSculpting. No, it doesn't work that way, and it will not actually help you one iota. Okay, that is because to recap, Patricia, is that CoolSculpting is a very contained area of contained atmosphere, and the temperature has to be maintained at minus 10 degrees for, again, the earlier applicator. For the newer applicators, minus 11 degrees Celsius, and has to be contained exactly at that temperature for a certain amount of time for it to work. And so if you actually sit in a cold room, or you actually hold some ice cubes over something, that temperature is not maintained consistent, so you will not induce the inflammation, and therefore the subsequent changes, like you would see with cryolipolysis.
Okay, now I heard this one too before from a patient doctor. They were worried about the fat when it's reabsorbed into the body affecting their cholesterol levels.
Earlier we mentioned that people actually did cholesterol studies, lipid studies, and they look at 6 weeks, 12 weeks out from the treatments. There's no appreciable change in zero lipid profile, and that's because the fat cells actually disintegrate slowly over the next 2 months.
Wonderful. Okay, and then another question that some people have asked here too is, you know, they have a friend that went and had CoolSculpting done somewhere else. Mm-hmm. They didn't really see any results. Mm-hmm. Why would that be? If you went somewhere else, you wouldn't see results?
Okay, I think seeing result is a couple of things. I don't think that CoolSculpting actually fails. I think that if you attach the applicator, you're going to get results. So CoolSculpting doesn't fail. I believe that result is more up to the individual to understand what CoolSculpting can do. Now, if you have unrealistic expectation, you're going to say you're not having results. A lot of times, the before-after pictures that you may have seen from CoolSculpting looks terrific. Sometimes it looks as good as a surgical procedure. It is in our practice that we want to have people to come in, and basically we have people of different sizes. So during my consult, I will actually choose a real picture of our patients there before and after. That's the same size that of the patient who's been interviewed, who's been assessed, and we want to give them a realistic expectation. Now, if patients are being shown a realistic expectation of 20% reduction, they know what to look for, then they would actually see that CoolSculpting works. For most patients of medium size and a little bit bigger than that, you're going to need at least 2 to 3 times treatment in the area because maybe the first 20% won't show up that much, but you'll actually feel that the clothes are fitting better. So for people to claim that CoolSculpting doesn't work, is probably is that they're not having the realistic expectation. Now, the only time that CoolSculpting may not work is, or may have an adverse reaction, is it goes back to that paradoxical hypoplasia that we're talking about. Otherwise, CoolSculpting is expected to actually pretty much works with everyone.
Okay. And if someone wanted to come in and talk to you and have a consultation, is there a cost?
Okay, there's no cost to patients coming in to visit with us. We want, this is a procedure in which, it's not an emergency procedure. It's a procedure when you want to have a lot of thinking about for you to go through. We want you to have enough time for question and answers. We want to have enough time to assess you as a patient and make sure that you're a candidate for CoolSculpting. So at no point in time that we will charge a fee for that. We want the patients to be going through a procedure with full understanding, and they're comfortable through each of the procedure, and we want to make sure there's enough time allowed for that.
Wonderful. And on one of Jenny's posts the other day, one of our Facebook friends asked if we had any before and after pictures to show, and I know we have our little CoolSculpting flip book behind you. Is there a way you could show maybe some of those before and afters to our Facebook friends here?
Sure. Okay, so let me reach over here, and these are pictures that are not from us, but they are from a lot of patients that have been throughout the years with different practices, and these practices actually send in the pictures for Zeltic, and basically they make a compilation of that. When patients come into our practice, they actually get to see our own patient picture, that are basically from us. All the pictures are basically anonymous. You really don't know who's, who it is. You would only be shown just the before and after pictures of the areas being treated. But these are very good pictures of actually examples of what CoolSculpting can do. So with CoolSculpting, we also have different sizes of applicators. And then I'm going to ask Patricia to actually pass me the large applicator right here, Patricia, that is actually on the machine right here. So we will actually have to assess the patient according to the size of treatment. This is a large applicator. You can see it's pretty large, okay? It's pretty large. You can see it's almost covered my side from side to side, okay? So with this large applicator, we actually use in patients who actually can fit that applicator. We also have smaller size applicator that actually you don't need to do that. You can just give me the templates. Mm-hmm. Okay, so we'll actually use these templates to mark the patient. So with the large applicator, you can see that it's a lot bigger. Okay, that was the large applicator I just showed you. And then we have a smaller applicator. This is a template for it. So it's pretty much like about, maybe about 60% size of the large applicator. Okay, Alrighty. So here are our 3 small applicator. They have actually different curves. The Cool Fit, we actually use it for the thighs, the arms. The Cool Curves, we actually use it for the love handles and the tightness of the back a lot. And then we have the Cool Core, in which we actually use for the abdomen, the back, and also the thighs sometimes. So we will actually fit the patient into and size the patient into one of these applicator before the treatment. And I want to, since you're joining me right now, definitely want you to come and visit back with us, because we're about to post, if not today, probably by tomorrow for sure, an actual treatment in which we have done on Jennifer, who's our laser technician, and we'll walk through the whole treatment process. It's a great video to learn about CoolSculpting. We hope that you'll tune back in to actually review our video.
You know, one other question, Doctor, that maybe somebody's not too sure about with CoolSculpting is, do you have a choice on which parts you're working on? Are we doing a full body thing? Can someone pick and choose the body parts that they want to work on?
Okay. Can you pick and choose the body that you want to work on? Absolutely. Do you want to do from head to toe? Absolutely. I think the reason that you may not want to do from head to toe, unless you actually win the Powerball tonight, by the way, I think it's up to what, 700 million?
Yes.
You're going to get some tickets?
I hope so.
I will too. Okay. So if you're the lucky winner of that Powerball, you can definitely do from head to toe. There is some cost to CoolSculpting, so a lot of times patient will pick certain body parts that would actually irritate them the most, and then they will actually work from there and maybe save a little bit more money and then do another body part the following year. All right. And we actually have Duke Key joining us. Thank you very much, Duke. He's asking, so our first question from a gentleman. The other questions that I commonly get is CoolSculpting mostly for women or for men? Actually, the men's are doing this quite a bit too. I believe the breakdown nationwide is 40-60. 60% women, 40% men. Most of the men actually only have most of the fat really around the waistline, but the belt line, that's usually where they're coming in, and probably the double chin. Women, we actually have the ability to store fat in other areas like the back, the arms, the thighs, so we have more space, more areas that we can actually do CoolSculpting. Men are usually more around the waistline and the double chin. So with Duke, the question is, can you help me reduce a few inches with my tummy? Yes, absolutely, Duke. Thank you very much for that question. We can actually reduce the size of and make the size of pant size, and actually make the clothes more fitting, more comfortable for you. And basically, you just need to come in to be assessed by us and see how many cycles or applicators we need to use on you. Each time that we actually do the treatment, you get about 20% reduction of the subcutaneous fat in that area. So we may have to do actually 2 treatments to actually reduce a little bit more, but certainly we do have plenty before and after pictures for you to view. The other things that we have successfully actually regained a lot of V-shapes for the men because of the love handle. So I think that you'd be very, very pleased. So just come on in and see us, and we'll assess you and we can go from there. Thank you very much for your question.
All right.
Another thing, so let me just continue this, Patricia, because we sort of like got lost into the applicators. Okay, so if the patient can see that, for instance, for this treatment, this is the large applicator for this patient to use on the for the belly in the lower abdomen. For the upper abdomen, this patient actually has 2 small applicator and then 2 on the side for the flank. So this patient has 5 applicator total, and this is from the before to after picture. Okay, that you can see. And pretty much, if I flip through the whole book, it's going to be a lot of before and after pictures of different areas. And like I said, it can be used to be treated for the trunk, the arms, the the submental area, as well as the thighs.
Wonderful. Okay. Now, do we want to talk about our upcoming promotion, Doctor?
Oh, okay. So Patricia is actually reminding me of a very, very exciting contest that we're actually having. So, so in summary, as you know right now, how much time do we have left?
We still have about, I believe, 20 minutes, but I do want to stop you real quick. We have a question from Kimberly Joy that just came in.
Okay.
She asked, would I lose weight or just inches with CoolSculpting?
Okay, that's a very good question, Kimberly. Thank you. So you will actually not lose any weight because fat doesn't weigh very much, but you actually lose inches. I've actually, here we don't measure inches. We actually take before and after pictures. You can visibly see the bulges of the subcutaneous fat going down. But my patients actually have done their own measurement, and some have lost an inch and a half or so. After one treatment, that's not bad. An inch and a half is pretty good. Yeah. So inches, but not weight loss.
I love what you had to say before when you were talking about comparing working out to an hour in the chair. How much you'd have to work out to lose that inch versus just sitting an hour in the chair.
Yes, exactly. And that's on our video that's coming up with Jennifer. You'll see a treatment with Jennifer. She does work out, but she does have, like I said before, with a lot of younger patients, younger ladies, they do have that little pouches in the lower abdomen, and Jennifer has been getting treated there. And pretty much you will be able to see what we call treatment to transformation, T2T. That means you get a treatment and you're transformed. So treatment to transformation, T2T, with Jennifer, will be able to follow her. Jennifer is going to get 4 hours of treatment total. We've shown the first hour. We've actually videotaped it, and we're actually about to post a video either later on today or tomorrow, and you'll be able to see that. And during the next 2 weeks, we'll actually be doing a couple more hours, and 2 months down the road, you'll be able to see the final T2T for Jennifer. Now, I think Patricia wants me to discuss what we have is a really, really exciting contest that we're having, and not that I know of has been done from coast to coast. With CoolSculpting has been happening for the last 7 years, so not that I'm aware of. Okay, so I've actually gone to Pleasanton in California about less than 2 weeks ago, and we've actually had a little bit advanced training. There's only 40% of practices that own CoolSculpting machine have advanced training. We decided to go. We decided to send Jennifer, and I kind of tag along. There's always some good learning material. You can always pick up, over 3 days of learning. And I did. I certainly learned a lot in terms of social media, because I am not good with social media, but certainly there's a lot of hand-on experience. I love the ability to actually see their classes up close, and I'm very committed to thinking that from now on, all of my staff should go to CoolSculpting University. Okay, so basically at CoolSculpting University, this light bulb kind of came up, and I was thinking, wouldn't it be terrific to actually offer a patient CoolSculpting transformation? So treatment to transformation, T2T, we're actually offering that to a deserving patient for free. Okay, so this is wonderful, Patricia. So what's the next question you may want to ask me if we're going to do treatment to transformation for free?
What do I do? How do I get that?
Okay, wonderful. We've actually posted on Facebook under the notes category, and we're going to continue to post that. Basically, how to enter our contest. First of all, you need to know that our contest ends on October the 15th, so you want to get into the contest. And to enter the contest is very simple. Okay, first you're gonna like our Facebook page. Go to North Texas Skin and Laser, like our Facebook page, and actually post a video of the areas that you want to be treated. So you might want to just say, hi, I'm so and so. Show the areas that you want to be treated, and please let us know how would CoolSculpting transform you and help you gain maybe your self-confidence, help you in an upcoming wedding. So tell us a story. Tell us a story. And then the third part is, if most of you watch Dancing with the Star at all, I myself like Dancing with the Star. I love watching that. I think it's a lot of hard working to get there, but I like the fact that families and friends get to vote. So for the third part of our contest, what you need to do is actually have your friends and family share your videos, have your friends and family go to our Facebook page and like it first. They have to like it first, and then they, under your video, under the comment section, write in the word vote. Okay, so I believe that Facebook is going to keep track of all those comments and votes, and basically the top 3 videos that have the most votes, that means you can get your friends and family to vote for you. You will be invited, the top 3 finalists will be invited into our practice for assessment and to make sure that you're a candidate for CoolSculpting. The winner will be chosen and we'll announce it on Facebook, and the winner will be treated from treatment to transformation of an area of their choice. And this package, folks, is actually could be up to $7,000. Normally, the cost is not up to that for one area. It may cost more, like maybe anywhere from $1,500 up to $3,000 to $4,000, depending on how many cycles you need, but roughly between $1,500 to $3,000. We're offering all the way up to $7,000, mainly because we may actually need 2 phases of treatment transformation. Remember, I tell you that you're going to get 20% reduction. You may actually need another series of treatment after that to actually completely transform. We're dedicated. We want to focus to make sure that we're going to get that result. So we're offering up to $7,000 worth of treatment to transformation on CoolSculpting. All you need from you is upload your video, like our Facebook, upload your video, tell your friends and family to vote. They have to like our page first as well, and get as many people to participate. And this is really a once in a lifetime opportunity. It's also currently, as I know it, it's the only one being done right now from coast to coast, and for the last 7 years that CoolSculpting has been out. So we're looking forward to having a lot of participation from y'all.
Great. Well, if someone had more questions, let's say they see this video after we've posted it and we're not live anymore, how should they get in contact with us, Doctor?
I guess, it's a lot of ways that you can actually contact us. You can, easiest way, pick up the phone. Okay, we would love to visit with you in person if we can, or it's a quick answer. We would love to answer through the phone. We also have an email. It's info, so info@NorthTexasSkinAndLaser.com. So I'll spell out info@NorthTexasSkinAndLaser.com. The other thing is they can also shoot us a question through Facebook. Different ways. Visit in person, call us, email us, or Facebook us. Yeah.
Right, we're conveniently located in Corinth, so we're kind of close to everyone. And give them our number, if you would, Doctor.
Okay, sure. Thank you very much. Patricia is like keeping track of what I haven't said so far. Okay, so our phone number is 940-382-0888. Again, that number is 940-382-0888. We're located at 1410 Robinson Road, Suite 300, Corinth, Texas 76210. We love to see you, and we love to see you starting to put those video up there on our Facebook page.
And of course, if they have any other questions, they can go to our website. Our website is?
Oh yes, yeah. So we do have a lovely, lovely website. It is NorthTexasSkinAndLaser.com, and on there you actually find information on CoolSculpting. You find information on other things that we do, such as laser hair removal, laser vein treatment, and many anti-aging services that we have. We also have many skincare products that are only basically what we call cosmeceutical or professional grade skincare products. And you can learn all about it through our through our website, NorthTexasSkinAndLaser.com.
Great. Well, thank you, Doctor, so much.
Is the 1 hour all done?
I think it's pretty much up. We've answered so many questions.
Well, thank you very much, Patricia, for helping us, and thank you for all of you for watching. 1 hour goes away very, very quickly. It kind of reminds me today of what I used to do. I was also in teaching at Baylor College of Medicine, and I was a graduate there and also did teaching there for 2 years. So thank you very much for participating. If you have any question, please contact us. We love to chat with you and visit with you in person, and also wanted to see this video up there as soon as possible. Thank you, Patricia. So I want to say hello to Patricia here.
Bye, everyone. See your videos soon. Can't wait to treat you.